My name is Kevin Kaiserman. I'm a board certified pediatric endocrinologist working at Mankind Corporation as Senior Vice President, Therapeutic Area Head for Diabetes. So I am very excited as a pediatric endocrinologist working with children and teens and their families for more than 30 years. I joined Mankind about 6 years ago, specifically to try to bring the option of inhaled insulin to the pediatric population. So I'm obviously very pleased that after FDA review, we now have that indication and that option for people. And this really ties in with the recent updates to the American Diabetes Association Standards of Care, which talks about that shared decision making between HCP and patient and really give them the option of what is the best therapy for them, what is the best way for them to deliver insulin. And rather than a clinician making that decision for them, really having that shared decision making and really discussing that optionality. And as the standards of care say, discussing at every visit which mode of the insulin delivery would work best for them and including inhaled insulin as an option. So we have that option, had that option for adults when that came out, and now very pleased to have that option also in children. So, one of the important things, we've seen so many wonderful changes in diabetes management over the last 30 years, is that people need different tools at different times of their journey with diabetes, and children have unique needs. They have very erratic eating schedules. They have very erratic day-to-day schedules with their school activities and sports. And one of the nice things about inhaled insulin is the speed of action, the ability to really match that insulin immediately with their food intake or their activities. And so one of the things, kids eat erratically. You're not sure how much they're going to eat. Very hard to pre-bolus insulin. One of the things that I talked about most in my clinical practice, more than 25 years of seeing patients, was showing them that they often had, especially with CGM, being able to see the rise in glucose after meals, saying that you might benefit if you were able to bolus a little bit sooner. Very hard to do in the day-to-day management. The kids will say, we've got a short window at lunch, or we don't know when the food's going to arrive at the table when we're out to eat. The ability to dose right with that first bite of food is one of the clear advantages of inhaled insulin. It's really about being able to match that timing of your insulin with what you're doing next.